Hello, my name is Barb Winters. Welcome to Port Huron Hospital's Today's Health. You know, when your hip hurts, you can't stand, you can't sit, you can't lay, you can't walk up the stairs, you just want it fixed. So joining us to talk about this important topic is board-certified orthopedic surgeon Leonard Karadimas. Dr. Karadimas, welcome back to Today's Health.
Thanks for having me, Barb.
So let's start with the anatomy of the hip.
Sure. Well, basically, the hip joint is a ball and a socket, and we have a little diagram or a little animation right here. And this is the socket part of it. It's called the acetabulum, and then the ball is basically the femoral head, and where they join together is basically the hip joint. Certainly, you have the femoral shaft or the femur, the thigh bone that connects to the ball, and the socket sits in the pelvis. But the actual hip is this area right in here, the ball and socket joint, the femoral head and the acetabulum.
Well, it looks pretty simple, but I also know nothing is as simple as it looks. So what causes hip pain?
The most common cause for hip pain in the United States or in the world is going to be arthritis. Basically, the cartilage surfaces at the end of the ball and socket simply wearing down. Other causes include bursitis, which is basically inflammation on the outside portion of the hip here where you have a bursal sac and a tendon. And more recently, we've found another etiology which is called impingement, which is basically small spurs, osteophytes, prominence in this area that cause pinching of that hip joint when it moves a certain way, causing pain for people.
Well, let's start a little bit with bursitis.
Okay.
I'm thinking that could happen at any age. Is that true?
It is true. I tend to see it more in middle-aged folks. I see it on a clinical basis more often in a female population, but it can occur across the board. I should say I see it in young female athletes as well, cheerleaders and things like that. But classically, you're going to see it in more of a middle-aged female population.
And how do you, what are the symptoms? Does it come on suddenly? Is it excruciating pain, nagging pain?
Yeah, well, I see a lot of people in the office that come in for hip pain. So in general, I always, ask them the location. And if you have pain in your groin, anterior in the front, that is coming from the ball and socket joint. Something's going on in there. If your pain is lateral or on the outside part of your hip, that's almost always bursitis. And if you have pain in the buttock area, which some people kind of consider their hip, that's usually more of a sciatic nerve problem or really kind of a back problem.
So how do you treat bursitis then?
So bursitis is basically it's an inflammatory problem. It's inflammation of the bursa. And so traditionally you try to affect that inflammatory process. Oral anti-inflammatories like Motrin type medications, corticosteroid or steroid injections are usually the most helpful things. Physical therapy for some stretching exercises and ultrasound and so forth can be very effective. For non-surgical treatment, traditionally there weren't many options for surgical treatment, but in today's day and age, especially in the past couple of years, we've been doing arthroscopic bursectomies and things like that.
Really? So you can actually take part of the bursa that's inflamed out?
You can. What you do is you would make typically a couple of incisions, one here and here, small poke holes, enough to get a little camera through about the tip of that pen, and you would go into the outer part of the bone here, find the bursa that's inflamed, swollen, and remove it. Also, sometimes there's a band of tissue here called the iliotibial band or tensor fasciae lata that's kind of pressing over that bone, and what you can do arthroscopically is sort of release that or kind of loosen that up so there's no more pressure along that outer hip area.
Now, is this for someone that has chronic bursitis, chronic hip pain that you know is the bursa?
Typically you're going to know. I mean, people who have bursitis it's a very classic thing. I have pain on the outside of my hip, the lateral side, it's not in the groin or the buttock. It hurts when I lay on it. It hurts with certain activities that are classic for trochanteric bursitis. So this area on the outside of the hip is called the greater trochanter, and technically it's called a trochanteric bursitis.
And so does that ever go away on its own? Do you always need to see the doctor?
Well, you know what? I think if you're having symptoms like that, I would say start with some oral anti-inflammatories, over-the-counter Motrin for 2 to 4 weeks. And if it doesn't improve after that period of time, I think you're probably best to go see a a physician for it.
Well, we're going to take a break, and then we're going to come back and talk lots more about your hip.
Perfect.